So ma'am, good morning. This is Sunshine Rose Nunuan, your student nurse of Ifugao State University. But before we are going to proceed for the assessment, I will verify first your identity. So what is your full name, ma'am?
My name is Precious Primano.
Precious Imano. How about your birthday?
May 4, 2004.
May 4, 2004. How old are you now?
I'm now 18 years old.
18 years old. Okay, thank you very much, ma'am. So today we are going to inspect, or we are going to assess your head and neck. But in order for me to do the assessment, I will ask for your consent, ma'am, to touch or hold certain parts of your body that's involved in this assessment. Is that okay for you, ma'am?
Yes, ma'am.
Okay, ma'am. Thank you very much. So we are doing this assessment to ensure that your head and neck is free from any abnormalities or misfunction of the tissues and organs. So we'll ask you certain or some questions, ma'am, regarding your past health history. So do you have any limbs, lesions, or masses that disappear?
No, ma'am.
Okay, so any difficulty in moving your head or neck?
No, ma'am.
Okay, so any previous head or neck problem po?
No, ma'am.
Okay, so any family history of head and neck cancer?
No, ma'am.
Okay, so nag-i-smoke po ba kayo, ma'am?
No, ma'am.
How about wearing of hat or helmet po?
No, okay po.
Let's see. How about wearing of hats or helmet, ma'am?
No, ma'am.
Okay, thank you very much, ma'am, for giving me all those information. So, okay. So, before we are going to proceed for the activity or the assessment, ma'am, I will just close the curtains and the doors to ensure your privacy po. Is that okay?
Yes, ma'am.
Okay, thank you very much. Okay, so let's assure that I already prepare I already closed the door and the curtain for the privacy of the patients. So I will just apply my hand hygiene to prevent the spread of microorganisms. I also wear my hand gloves, ma'am. Okay, so first we are going to inspect the head of the patient first. Okay, so ma'am, I will just inspect your head. Okay, so your head is symmetrical, ma'am. It is in the midline and it is appropriate in your body. So now let's also inspect your head, ma'am, for the presence of any parasite, lesion, or needs. Okay, so I did not see any presence of lesions, scars, or masses, parasites, or needs, and even hair loss in your scalp, ma'am. Okay, so next I will also inspect your face, ma'am, for the symmetry, or the movements, or the appearance, and even the skin the skin condition. The next, we'll check the cranial nerve number 7, which is your facial nerve. So, ma'am, kindly raise your eyebrow down, then blink. Okay, then smile po. Frown. Okay, so close your eyes tightly. Okay, thank you very much, ma'am. So I didn't see any lesions in on the face of the patients, and I did not see any droopings in the face, and it's all normal. Okay, so ma'am, let's also palpate your temporal artery. Ma'am, kindly open your mouth. Okay. Later, there's no present, there is no tenderness or swelling. Okay, so next. So next, we are going to inspect the neck of the patient. Okay, so ma'am, taas lang po tayo. Para makita ko pa na maayos. Okay, so the neck of the patient, it is in the midline. There is no presence of lesions or lumps, and there's no also presence of there is no swelling and bulging in the neck of the patient. So, ma'am, may masakit po ba nung na-check ko yung nung hinawakan ko yung neck niyo?
Wala po.
Okay, thank you very much. The neck of the patient is in the midline. I did not see any presence of lesions, lumps, and even swelling and bulging. So everything is normal. So next we are going to check the neck range of motion. So ma'am, kindly move your head on your left. Next we are going to inspect the neck range of motion of the patient. Okay, let's inspect your trachea, ma'am, or your thyroid gland. Okay, so it's normal. Your trachea is in your neckline. Next, we are going to palpate your lymph node, ma'am. First, we are in the preauricular nodes. Okay, so the post-auricular nodes. Next, on the occipital nodes. Okay, in the submandibular. And then in the superficial. Okay, so I didn't see any abnormalities in that, and everything is normal. Next, we are going to inspect the eyes, the eyelids, the sclera, the pupil, and then the conjunctiva. Ma'am, tingin lang po sa taas. Then tingin sa baba. Okay, so the eyes is in the same position. The pupil is the same in size, and then the conjunctiva is pink in color. Next, we are going to test the cranial nerve number 3, number 4, and then number 6. So, okay, so ma'am, I will yes, I have a ruler here ma'am. So, lahat ng direction kung saan ko to dadalhin is diretso lang po yung mata nyo. Sundan lang po. Okay ma'am? Gets po ba?
Yes po.
Okay, sige. Okay, thank you very much. So, as I move yung ruler sa inyo ma'am, so diretso lang po yung tingin. Okay, so I didn't see any abnormalities po dun sa pag-test ko sa movement ng yung eye, ma'am. So, okay, thank you. These are normal. Next, we are going to inspect also the ears of the patient. Okay, there is no abnormalities, there is no dryness or severe dryness in the ears of the patient, so everything is normal. Next, we are going also to inspect the nose of the patient. Okay, so it is in the midline, and then it is the nose is symmetrical, and it is in the midline. Okay, so we'll also check on the inside of your nose. Instead of using pen light, we will use another thing. So we'll use a flashlight. This must be a pen light in order to there's a focus in the light. Ma'am, hinga lang po tayo. Okay, so ma'am, may I ask you to close your eyes, and then I will place something beside you. I will put something in front of you, and then use your nose to smell and to determine what object is that. So you need to close first your eyes, ma'am. Okay, so ma'am, please determine on what object is this.
Alcohol.
Okay, thank you very much, ma'am. So I didn't see any abnormalities on the way the patient on this smell or in the nose of the patient. So the findings is normal. Next, we are going also to inspect the mouth of the patient. First, we are going to inspect first the lips. Okay, there is no presence of crack and also lesions. The color is pink. So ma'am, kindly open your mouth po so that I can able to inspect inside of your mouth. Open it. Okay. Please open it wider, please. And even kindly pull out your tongue. How about your teeth? And how about your ovula, the inside of your... Okay. The color of the mucous membrane is pink and shiny, and even the teeth is color white. The ovula is in the midline or in the center, and then the soft and the hard palate is also normal. I didn't see any abnormalities in the inspection. Everything is normal. So that's end our inspection, ma'am. That's end our assessment, ma'am. Ma'am, if you have any clarifications or questions regarding your pain in your body, I will refer you to your attending physician so that she or he will be the one to explain you everything. So thank you, ma'am, for your active participation for this assessment. After the assessment, we will remove our PPE and apply again the hand hygiene which is the alcohol, to prevent the spread of microorganism or any contamination, cross contamination.